All right. So first thing I'm going to do is I'm going to show you anything that we've discovered regarding potentially low back pain, because I did some testing on you with your range of motion, with your bending, with your twisting, with your legs up, and what I tried to do is piss off your disc, and I could not do that. So congratulations, you do not have a disc issue with numbness or tingling, or at least at this point in time that's positive. So as a result of that, I'm not going to teach you or talk to you about what is possibly not there, because there's a million things we could talk about. I'm only going to talk to you about what is there and what we found today and what I'm noticing that may be potentially causing your issues. So we know that when it comes to power, strength, and mobility, the number one thing is really your hips. It doesn't matter if you play tennis, you squat heavy weight, or you like to go running. The way you don't generate power from your toes or from your little pinky. You do it from your hips and your pelvis. That is how you fix lower back pain. When I was testing your hips, and we could have tested more, by the way, when it comes to like hip flexor movements and stuff like that. The truth is, I'm actually going to find out a lot more information as I dive in on you. But what we did is we tested the hip flexor. Let's go into here. So we know that the hip is a ball and socket, and it's designed to go through some flexion. Remember when I got up to about 90 degrees, it started to feel a little resistance, and then it went a little further. Your hip,
my hips kind of
pelvis. We call that in the fancy weightlifting world butt wink. That's natural. Butt wink is absolutely natural. It's just a problem when it gets so far. Butt wink, by definition, is when our pelvis tucks down to a point where now it doesn't have room in that femoral head or the socket here, so it rotates backward and creates more space within this area. You had significantly more or more reduction or a more mobility issue in this hip flexor and adductor, which is not only did we see in the hip scour test, which what we do is we scour the hip and we just do this. We kind of just feel the range of motion, and it kind of glides and slides, and once it hits that wink, the person does this. You did not have that comparatively. So if you squat at 90 degrees with this one, you'll be fine. You squat at 100 degrees for both of them, you're going to start leaning towards that way, which is what he did he not? Go this way. So in this case, what you did is you toed out in this direction. You externally rotated with the right leg. The reason you externally rotate in that right leg is to open up that hip joint, creating naturally more space. This is why you can go like anybody lifting can do this and have more pelvic space versus when I did this, you're like, damn, this is hard.
It's more difficult.
So you might be having a little bit of impingement going on, and if that's going to happen, you're going to splay around and create more compression to the lower back down here, maybe injuring some of the ligaments and things like that. So I think right now your biggest issue would be opening up this hip, working. Let me show you some of the muscles here. So, and also, by the way, we have nerves, we have arteries. I can kind of add a lot of stuff here.
It's a lot of good stuff.
So I think in this case we can do the adductor longus, the pectineus, pretty much, adductor brevis. We can probably work the adductor magnus a little bit, but definitely hip flexor stuff. And going through that, and then really trying to open up the joint. You know what it feels like to kind of keep your feet straight now-ish and squat. So we're going to use that as our litmus tests and our baselines. And of course, we'll do some chiropractic adjustments to introduce you. If we need to work some of the multifidi and other things within the low back, we may have to. But I think primarily, let's focus on the hips and the pelvis. Do you have any questions on that?
No, I mean, that's pretty cool. I'm learning different things about how, certain movements are limited for me. So, I mean, I didn't really take it as a big deal before. Like now I'm like, okay.
Yeah. The way you really fix low back pain is not by treating the back, even though the little muscles that Jonathan and I both work on a little bit make a huge difference because it's like pressing Control Alt Delete. It's like resetting the fibers.
Yeah.
That's fine, but if you really want to solve it long term, you can't get any power or mobility without having hip.
Yeah.
And this is why volume or repetitions increase your problem, because you can do 3 or 4 weights cheated with, like, let's just say 300 pounds, but once I give you 200 pounds, you're doing it 40 times, and you're like, geez, this is really catching up to me, because it's exploiting your weakness. Okay.
Yeah. Okay.
So